outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back on the Radiosurgery Hour. We're talking about treatment options, treatment choices that each one of you may have the choice to make, or may have a friend or loved one, and talking about the philosophy, trying really to educate you with the data so that you're prepared to handle decisions when they hit you. Sometimes we're not given the choices and the time we need to address each question and medical concern. So we talked about acoustic neuromas. We talked about prostate cancer. And I want to spend just a few minutes talking about the big one for women, and that is breast cancer. Breast cancer affects about 250,000 women in the United States a year. And there seems to be a lot of confusion. Many women seem to believe, falsely as you'll see, that if you remove the breast when one has breast cancer, you're going to get better results. It almost seems as if some women believe that they make a pact with God that if they lose the breast, they're going to save their life. Well, is that true? That's the $64,000 question. And there's a news analysis that was just published that looks at this very issue. And there's data from the University of Utah that looked at breast-conserving surgery, which in fact leads to improved survival in breast cancer compared to mastectomy. And this is in a large retrospective study that was recently published. We've got a call. We'll take it and we'll go on. Radiosurgery New York, good evening. You're on the radio.
Yes, I'm listening to it now.
Great.
I don't want to be on the radio. I would like to have some follow-up information about how I could be in touch with Dr. Lederman.
Well, you're in touch right now, and if you want to be in touch off the radio, just call this number when we're not on the radio, which is usually best times Monday through Friday, 9 to 5, or any other time you want.
Okay, well, I'm 85, and I do need a prostate operation, and I've waited many years for it. I actually have a a catheter in me there for about a year.
Well, we need to fix that.
To get the proper treatment. So I think you sound like the person that could really do it. It's what I really believe in progressive medicine.
All right, well, give us a call.
And I'll make it arrangement. Where is your office?
It's at 38th and Broadway. We're on Broadway, right between Macy's and Times Square in Manhattan. You can take almost any bus, subway, or train and find us right there.
Okay, Dr. Lederman, you have a fine voice. It's really amazing to listen to you on the radio. You can hear yourself in the background here and now. It's exciting to talk to you. I will get back to you, sir.
All right, God bless you, and thank you. Have a nice holiday.
Thank you, sir.
Bye now.
All right, bye-bye.
So we're talking about breast cancer. We're talking about women who choose lumpectomy, which is to remove the lump of cancer and save the breast, versus mastectomy. And in this retrospective study, women treated with breast-conserving therapy, meaning you keep your breast, had a higher survival at 5 years and at 10 years compared to mastectomy. And overall, controlling for differences among the patient groups, the groups that saved their breast yet had breast cancer treated had a 30% improvement in survival versus mastectomy. Wow. 30% more women were alive with lumpectomy and radiation versus mastectomy. So it's another study that is pretty important for women with breast cancer. And there's been studies actually for the last 20 years showing that the two treatments are at least equivalent. And we know that cosmetically saving the breast is by far superior. We know that reconstruction never can reconstruct the breast that God gave you. The nipple areolar complex has sensations which cannot be recreated in a reconstruction. This study goes on to show, and I quote in the JAMA, it was published in JAMA Surgery, which is a very prestigious journal, our analysis of a large and contemporary cohort of patients demonstrates that patients who undergo breast-conserving therapy have improved breast cancer survival compared with patients who undergo mastectomy. This is for invasive ductal cancer. So here you go, 3 studies talking about brain tumors, prostate cancers for men, which affect 250,000, and breast cancer, which affects 250,000 women in America. Wow. This study from Utah actually looked at 132,000 women. So it's a very large study. The overall survival, if you saved your breast, was 97%. So 97% of women were alive 5 years afterwards. The mastectomy rate was only 90%. At 10 years, 94% for the breast-conserving therapy versus 83% for mastectomy. So any way you look at it, the group that saved their breast had a better survival and a better cosmetic result, and I suspect fewer regrets. So before you do the cutting, you might want to do the investigating, and I always encourage people to get a fresh second opinion. You're welcome to contact us. We're at 212 Choices, just like the gentleman you heard, 212 Choices, which is 212-246-4237. We like to say that we're not only super convenient, I think we are super convenient. We're near most all buses, trains, subways, Grand Central, Penn Station, Port Authority. But I think we're also super. We take your calls. There's no machines. It's a private cancer center, which means you're the boss, not some pharmaceutical company, not someone else, not patients going ping-ponging around a hospital from one corner to another corner, seeming never to get out of that place. So give us a call if you wish. We accept most insurances, Medicare, Medicaid. You can call our number 7 days a week. That's 212 Choices. You can speak directly with the doctors. We have no strange faces and no miles of cold corridors and locked doors. Here we know who you are and you know who we are, and you're always welcome. 212 Choices. Hey, there's lots of talk speaking about surgery since we're beating up on the surgeons tonight, and they think some of them deserve it. Not all of them. Some surgeons are my best friends, and I mean that seriously. When you have acute appendicitis, you want to know a surgeon. So we know that surgery does good things sometimes. There was a study that looked at readmission rates for prostate cancer. Now, a lot of people have been, I think, bamboozled to think that robotic surgery is the be-all and end-all of prostate cancer treatment, that you can see better or cut better or do better. Well, previously I gave you the data that looked at complication rates from robotic surgery, sexual complication rates and urinary complication rates, and actually the complication rates were higher with robotic surgery. And that was a study from Harvard Medical School than with open surgery. And now here's another study that was just published in the Journal of Urology, which is a prestigious urology journal. And they looked at 2,300 patients who either had open surgery or robotic surgery. And guess what? The complication rates and the complications requiring readmission to the hospital. So you have your surgery, you go home, and whoops, you have to go back to the hospital. Well, the readmission rate was 9% after robotic surgery. No different than open surgery. So if it was less complicated and less complications, would the readmission rate be the same? I don't think so. And that's the point of the study, that if it was a better operation, there wouldn't be a readmission rate that's about the same. Actually, it looked at 24,000 prostate cancer patients undergoing prostatectomy between 2000 and 2011, and 2,300 of them, 10%, required readmission in the 90 days after surgery. So that readmission rate for robotic surgery compared to open surgery was no different. It's 10%. It does not seem like it's a better operation from the point of view of cancer-free survival or complications or readmission. And guess what the readmission rate with us is when we give focused beam radiation and brachytherapy? I've treated 3,000 people. I can't even remember one patient who ever went and stayed in the hospital. So it's a very different experience, and we want to give our patients the chance to have the best experience, which means the best survival, the best quality of life, prostate cancer, urinary life, sexual life, and most importantly, to be cancer-free. So we're going to take a little break from the man truly with the golden voice, with got platinum and rubies and emeralds around his voice. We're taking your calls. We're live at WOR. We're at 1-800-321-0710, 1-800-321-0710. We'll be back just in a moment after this short message.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're back beating up the surgeons, only justifiably. We love surgeons, and we love when they do great work, and we love also when they refrain or give patients a chance for a second opinion to learn about other options.